Okay, good afternoon, guys. I've got B for you. We're discussing taking charge of your health with the annual preventative visit to your doctor. So here we go with the presentation I made for you. Please sit back and enjoy. Here's a deeper, more vivid explanation of that line: take charge of your health with the annual preventative visit. Based entirely on the page you're viewing and expanded to give it more meaning, uh, context, and usefulness. What this message is really telling you. When the page urges you to take charge of your health with the annual preventative visit, it's doing more than promoting a benefit. It's reframing the way older adults think about their health care. Instead of seeing health care as something that happens to you, appointments, tests, treatments, the page is encouraging you to see your annual wellness visit, AWV, as a moment where you step into the driver's seat. It's a yearly checkpoint designed to help you understand your risks, strengths, your habits, and build a personalized plan for staying well. This isn't a passive check the box appointment. It's a structured, intentional conversation about your health trajectory. What the annual preventative visit actually includes. The surrounding page content lays out the AWV as a Medicare specific preventative service, not a traditional physical exam. It's built around assessment, reflection, and planning, not hands-on diagnostics. Here's what the page emphasizes: a health risk assessment. This is the backbone of the visit. It's a guided questionnaire that helps you and your provider understand your daily habits. Your safety at home, your chronic conditions, your emotional well-being, your functional abilities. It's a snapshot of your whole person health. Review your medical and family history. It isn't just paperwork, it's about identifying patterns: heart disease, diabetes, cancer, cognitive changes that may run in families and can be addressed early. Basic measurements. height, weight, blood pressure, and other simple metrics help track trends that might otherwise go unnoticed. 4. Cognitive and mood screenings. The page highlights the importance of early detection. Subtle changes in memory, mood, or thinking often show up long before they're obvious. This visit creates a space to catch them early. A personalized prevention plan. This is the heart of the AWV. You leave with a written plan that outlines which screenings you need and when. Which vaccines you're due for, lifestyle recommendations tailored to your age. Here's a clear, grounded explanation of the phrase, the hidden dangers of skipping your annual physical exam, based on the page you're viewing. What the text really warning you about. The page uses the headline to signal something important. Skipping your annual physical isn't just a missed appointment. It can quietly increase your risk of preventable illness. Delayed diagnosis and more complicated health problems down the line. Unlikely a Medicare annual wellness visit, which is planning focused, the annual physical, a hands-on medical exam. The page emphasizes that this type of exam can reveal issues you may not feel, notice, or think to mention. Key changes, key dangers the page highlights. Here's how the surrounding content frames the risks. Silent conditions go undetected. Many serious health problems, high blood pressure, diabetes, heart disease, thyroid disorders often develop with no early symptoms. A physical exam can catch these before they escalate. Skipping it means these conditions may progress unnoticed until they become harder to treat. Missed early warning signs. The page stresses that clinicians use physical exams to pick up subtle clues, unexpected weight changes, abnormal heart or lung sounds, skin changes, swelling, neurological uh, differences. These small findings can be the first hint of something bigger. Delayed diagnosis leads to more serious outcomes. When problems aren't caught early, they often require more aggressive treatment later. The page frames this as preventable danger, one that compounds over time if annual exams are repeatedly skipped. Lost opportunity for personalized guidance. A physical exam isn't just about detecting disease, it's about also a chance for your clinician to update medications, review lifestyle habits, adjust treatment plans, answer questions you didn't know to ask. Skipping the exam means missing a yearly recalibration of your health strategies. Five, increase long-term healthcare costs. The page points out that early detection is almost always less expensive than late-stage treatment. Avoiding the physical may feel convenient now, but can raise your future medical costs. The message is the message one in one sentence. The page is urging you to see the annual physical as a proactive, a protective, proactive tool, and warning that skipping exposes you to hidden risks. That accumulate quietly until they become much harder to manage. If you'd like, I can also compare this physical exam to Medicare annual wellness visit, so the differences are crystal clear. Okay, guys, that's your B. I will be on for C shortly. Give me a little bit for a break, please, and I'll be on with C shortly. For now, Gator Wellness, take care, folks.